Welcome back to the Doc Talk podcast. I'm Dr. Sheila Wijayasinghe.
And I'm Dr. Shaz Mamathani.
So it's here, Shaz. Like, we've been waiting for this all season one. Mm-hmm. Season 2 of The Pitt is back. And we are so excited because we wanted to start with a recap of the first episode and sort of see how this feels for us and you, our listeners.
Yeah, exactly. I mean, like, we've been so excited about this. We've gone through the entire first season with you all to catch you up. And now this new season is finally dropped. And like, Sheila and I have been talking about this. We're not committing to a whole season just yet. We wanted to sit with this episode, let it sit with you guys and see how it feels and then kind of see what the response is like and go from there. But we couldn't not talk about this episode. So we had to do at least one.
We're just going to do this one at least because it was really exciting and we've been talking it up quite a bit. Yeah. And so it's really interesting. Like, the first episode dropped last night. Shaz, you and I were texting each other, middle of the night wake up. We were texting each other. Like, there was a lot here medically, emotionally. It was a little bit of a quieter start, but like building the foundation for a really great season ahead.
Yeah, and we actually met some new characters too, and we're going to get into those as we talk about this episode. And it was really cool to see their different personalities and what they bring to the show, because they each certainly bring different things. And if you haven't watched the first episode, we'll just warn you. So season 2, episode 1, spoiler alert going ahead, because we are going to dive into the cases and the episode.
So let's get started by like the opening scene, which we did see on the... Do you hear an ambulance? It's in my background. I'm sorry. No, it's okay. I think it's gone now. Okay, so let's start right at the beginning, Shaz. And we actually saw this with the promo of season 2, where we saw Robbie riding into work on his motorbike.
Without a helmet. Like, I was screaming at the promo. I was screaming at the TV as like during the episode. And I suspect that there were a lot of Emerge docs around the world also screaming at the TV that the Emerge doc is not wearing a helmet.
Yeah, this was very much something that I think many of us were like shocked at.
Yes. And then the interesting thing is, I mean, like, I think this was very intentional. Like, they have Emerge doc writers on the show. And I think, I mean, like, it's, this man who just lived through a mass casualty event. He's watched patients die. We saw him really fall apart last season. And he walks into work without a helmet on. And I don't know if you noticed, Sheila, it is clipped to the back of his backpack. So, like, he has a helmet.
I saw it.
He just wasn't wearing it on his head.
Yeah, it's a useless helmet, right? Like, this is where we're like, helmet. What's that doing there? It felt very symbolic, like you were saying. Yes. Like, there was a lot to what he had just lived through, and he's just very free.
Yeah.
Or not.
Or not. Yeah. So that one definitely stood out for me.
So let's get right into it in terms of what the first cases that we saw. And so there was no easing in. We went straight into the episode with the stabbing.
Yeah. So, I mean, like, we met a few new characters in the first couple of minutes, but then there's a trauma that came in right away, and it was a big one. So this is often exactly how the shift happens. I roll in. I just feel like I'm like sitting down and setting my things down and like logging in. And there's a trauma page overhead, which is exactly what happened at the start of this season and the start of this episode.
And like very quickly, we're in this situation, which I was overwhelmed watching. Again, I'm not an emergency doctor. Clearly, watching this show has confirmed that I'm not an Emerge. But we get into this emergency department thoracotomy, so opening of the chest.
Yeah, so this is like probably quite literally the most extreme procedure in emergency medicine. So I was a little surprised that they opened up right away with this, but yeah, like it was a lot. This is something you would have been running away from, I think. So,
oh yeah, absolutely. Yeah. That wouldn't be my jam, but I found it really fascinating to watch because I was explaining it too. Somehow I was explaining it like that's not like something that I can't really explain, but I was telling my husband and my friend who were watching with us. And what was also really interesting, it wasn't just the procedure. There was a lot of like emotional tension in the room at the time because we've met now the new attending, Dr. Al-Hashim, who there's some tension between her and Dr. Robbie.
Yeah, and there was tension before they walked in the room, and that continued right into the room. You can immediately feel it. I was watching with my husband, and I was like explaining the thoracotomy and stuff to him, but like I kept saying out loud, I'm like, I don't like her. I don't like her vibe. I don't like the way she's talking to Robbie. And it was just really interesting to then see that carry into their interaction together. They clearly have a different style, a different risk tolerance, a different philosophy. Even like with Lerner is a very different philosophy in terms of like how aggressive to be in the procedure, but then also like how involved to get learners. Like it was really interesting to see that contrast between the two of them, like standing at the foot of the bed there.
So much. Okay, Shaz, I need to ask you this because I thought
Yeah.
of you immediately when I saw this procedure happen, the flip of the lung, basically. And I was watching this again, and both my husband and my friend looked at me like, is that real? Like, is that something real? And have you ever done this, Shaz?
So I'll say, yes, it's real.
Okay.
But that's as far as I'll go.
Okay.
This one kind of made me laugh out loud. It's a bit absurd, but like, I don't know if you remember, there was the one of the new med students, and she's like, well, he's already dead. Like, she made this like little side comment.
I love that
and,
new
like,
med student. She basically like does not give anything on this.
Yeah,
shift.
I know. It was interesting to see her, but she's not wrong. Like, in these cases, like, the patient really is already dead. So you're kind of throwing the book at them because doing nothing really guarantees death. So like, yes, this is a real procedure, like the hilar flip. The thoracotomies, I mean, we do at the center I work at, we're in an inner city emerge. So we get a lot of penetrating trauma, meaning stab wounds and gunshot wounds, which is when these thoracotomies do happen. So we do actually quite a few at our emergency department, in Edmonton, because of where we're located and the types of traumas that we get. But like, I have never seen nor done a hilar flip because it is exquisitely rare.
Okay, well, this highlights why you're my hero in this, because like I, again, remember seeing these procedures in the emerge when I did rotations, but like really interesting work, and they represented it well from what I saw.
And that's just it. I mean, I think this episode showed me, like, remember at the beginning where they had like the simulation and it was like torsade on the monitor. I'm like, I just turned to my husband, that's torsade. And then there was like even the protocols that were done. And there's like little medicine tidbits in here that really reinforces to me that this season is going to continue in the same vein as the last season, being very medically accurate. The protocols have been correct. The medicine has been correct. So it's really cool to have been able to see that continue in this episode too.
That's awesome. And for anybody who is just catching up on the Pitt and hasn't watched season 1, we did have one of the medical advisors, Dr. Jake, on for our last episode of the season 1 recaps. And so you can take a listen because he shared with us how much involvement there is from medical advisors to make it accurate. So let's jump into the next case that I think really like struck home here. It was the abandoned baby in the waiting room, Shaz. And this was like a very, very big, sharp emotional turn because this is something that actually happens sometimes.
Yeah, this one kind of hit me in the chest. The way that they set up the scene was very interesting. There was this patient who was in the waiting room who clearly is hearing impaired. So like you could see like this muffled chaos kind of happening around her. I really liked the way that they did that. And then I'm like, well, what is, there's something big is going to happen. Like, what is this? Why is everybody running towards something? And then you see it. And this one like really hit me in the chest.
Yeah, same. And have you seen this happen, Shaz, in your emerge?
Yes, thankfully it is very rare. It doesn't happen often. I can count, and never to me directly. I can count on my hands, like in my career, in my, residency, medical school, and attending career that's almost 20 years between all three of those, on my hand, the number of times I've even heard about it happening. So thankfully it does not happen very often.
Yeah. So this also sets us up for a really important teaching moment of the episode where we want to talk a little bit and share with you, our listeners, and also any medical learners listening around neonatal sepsis, so newborn infection.
Yeah, so they did talk about this once they kind of got the baby into the warmer. There was this moment between Robbie, the
Dr. El-Hashim.
Thank you. I'm like, it's a new name that I have to learn. So Dr. El-Hashim and Mohan, where they were kind of talking about what the workup was going to be. So this, I mean, from a parental standpoint, so we take babies under 28 days very, very seriously because any fever in this age population is very high risk. And again, it's not the fever that's the issue, it's what the fever indicates. So any fever in a neonate, which is anyone under 28 days old, we take very seriously and do a very thorough workup. And we kind of heard Mohan talking about that as well. So it's not just blood work. So they do blood work, like a wide kind of range of blood work. They do blood cultures. We do urine cultures as well. And then we do the most invasive procedure that we typically do in these neonates. It's something called a lumbar puncture or a spinal tap, because the risk of meningitis in these young babies with a fever is high enough that it's concerning, that it warrants this invasive procedure to make sure that it is not meningitis, because missing something like that can have devastating lifelong consequences and can even lead to death.
And this is why parents sometimes will wonder when I see a neonate or that under 28-day baby come in with a fever to my office, they're going directly to the emergency room to have this extensive workup done. And it's not meant to be something to be scared of. It means that we're taking it very seriously because of this high risk that happens. So, and this can present differently sometimes. It's not just a fever. Shaz, can you take us through that really quickly?
Yeah. So for the parents listening, again, it's not, I guess fever is concerning, but there can be other signs as well. So if there's poor feeding, low temperature is also an indication of potential sepsis, lethargy. And I want to clarify that word. Lethargy means like you cannot wake up your baby. Not that they're more sleepy than usual, but that you cannot wake them up. If they're irritable, so that word means not just crying or fussy, but like you cannot console them and cannot soothe them. Something is different. If there's any breathing changes, any color changes, these are all what we call red flags and warrant an immediate emergency department visit in a young baby.
Yeah, it's better to be safe, right? So this is
For
why
sure.
we want to emphasize this as a teaching corner for all of you. I want to go over another big case, Shaz, that really, for me, hit home was the young girl that came in with the bruising. So she had a cut because she had fallen down, is what they were reporting, the family was reporting. And this is a big case with Trinity Santos, one of our previous, residents who was very overconfident in season 1, feels a little bit softer this season already. And she did a great job with this case, I thought, in bringing up her concern that there is more to this story than just bruising.
Yeah, and I this was an interesting one because the chin laceration, the chin cut, we see these things all the time when kids fall, right? But then as soon as she started, like it's easy to just like look at the chin and not look anywhere else, but she started like exposing the patient, looking at her back just to listen to her lung sounds and saw this bruise. And immediately when I saw the bruise, I turned to my husband. I'm like, this is an issue. Like they're going to look at the rest of the body and they're going to see if there are other bruises. And that's exactly what they did. They just very gently and kind of while talking to the patient, I thought this was illustrated very well of just casually looking and exposing the rest of the body and seeing bruises in different stages of healing, which is a big red flag when it comes to non-accidental injury.
And this is a different type of high-stakes situation, right, Shaz, where, you had the thoracotomy, that emergency procedure happening. This is a different type of high-stakes situation that I've lived through as well. And earlier in my career, we see it in family practice as well sometimes where you have to act in this situation because it is our responsibility to report these concerns as a clinician. And even if you're not necessarily 100% sure. And it can be very difficult to do this, but it's also the most protective thing that you can do for that child. But it can be very difficult. And I think that they navigated that very nicely to sort of do the exam gently, like you said, and sort of bring up the concerns in a really gentle way.
Yeah. And I see this a lot more in Emerge, unfortunately, typically than in the community. And I think the key takeaway here for our listeners and for medical learners, if you have a concern for abuse or neglect in a child, it is our responsibility to act. So I think undercalling should be more of a concern than overcalling. And if there is concern, like just making that phone call to have an assessment done could be potentially life-saving.
Exactly. Let's get into the characters because we have new characters. We are setting the tone for season 2. Tell me what stood out to you.
Whitaker immediately stood out to me. So I had to kind of orient myself from a timing standpoint, right? Because it's July 4th, which means the new resident started on July 1. And it became slowly became very apparent to me that Whitaker is now a resident, right? So he was a med student in the first season. And then now it's several months later, he is now a first-year resident. And he has these 2 new interns or medical students that are kind of assigned to him. And he's really taken on this responsible role of doing teaching with them, asking questions. I loved seeing that with his character.
Yes, I loved Whitaker in this episode because he's really kind of grown up a bit. His hair is a little bit longer. He's got a kind of a cool look to him.
Yeah.
There's also this moment which made me giggle.
We texted about this because I was like, oh my God.
Garcia, the surgeon, comes down and she makes a note that you can't even tell when you're sharing a toothbrush or something. There was an incident that happened to them. And I was like, that means something there. That's a one line because Santos and Garcia.
Yes.
There was a vibe between them last season. And now we know that at the end of last season, Whitaker became her roommate, became Santos's roommate. So I'm are Santos and Garcia together? And that was all that was said was the toothbrush being shared. So clearly they're sharing a bathroom.
Okay, listeners, you heard it here first. This is our prediction that this is the first indication that Santos and Garcia are together in some way, because why else would Whitaker have access to Garcia's.
To a toothbrush.
Toothbrush, right? Totally. That it flagged for me immediately. Matt, like it, my husband, it went right over his head, but I immediately texted
same.
you.
Everybody
like,
else.
Yeah, totally.
Yeah. Very much
I love
so.
that one. Okay, so the other piece about Whittaker that I really, really appreciated was the interaction with him and Robbie, like the quiet interaction there. There was this patient that died, one of the nursing home patients who was a DNR who died. He was there with the med students. And just as they were about to leave, he asked for a moment of silence. And Robbie was about to walk in. He saw it unfolding and just observed. And it just felt like this full circle moment with like a little bit of comic relief of like, make sure your phone is off because that's what happened
the first
to
season.
Whittaker in the first season. I loved that moment.
Yeah, it was really great. It showed a lot of growth for him, and he's not just running around changing his scrubs every episode. He's like really holding his own. He's holding space, and he's teaching so beautifully. But Mel, on the other hand, I have to say, also one of our favorite characters, like beautiful character, Dr. Mel King. She felt different this episode.
She did. She was like kind of out of it, like not really as engaged as she normally was. I mean, that moment with her and Langdon was like kind of seeing the old Mel back, but then the rest of that first hour, it felt like she was carrying this weight. And then we learned why, and kind of close to the end of the episode, that she's been named in a lawsuit. And so it's going to be interesting to see how that unfolds over the course of the season.
And yeah, I'd love to dig into that at some point with you, Shaz, because that's a big concern that all of us have, and it really does affect us, right? And then we meet the new attending. We mentioned her before, Dr. Al Hashim. Big personality in her own way. I had a lot of feelings when we met her, because I think we're obviously like team Robbie, right?
We're team Robbie, exactly. I'm like, I had to check them. I'm like, is it because she's a female? Like, what is it about? Like, I wanted to make sure it wasn't a gender thing, right? But like, it's not that. I think you're right. It's because we're on Team Robbie, and I feel, we've talked about this before in our first season. He is the character that I identify the most with as an Emerge doc, because I feel like his practice pattern, his emotions are very similar to how I practice. And so I almost felt like I was personally attacked by her. I'm like, no, leave him alone. Yeah. Leave him alone. He's doing his thing.
Yeah, I hear you.
Yeah.
Yeah. It's going to be interesting to watch this play out, because the tension is there. And we'll see what happens. Like, it'll be really interesting. And then there's Langdon, who like walks in, baseball cap on, sort of quietly, obviously hadn't been there for a bit, shared that he had been in rehab, and admitted things to his patient that I thought was really like a big full circle moment. But that's also going to have its own moments throughout this season, I think.
Yeah, that's exactly it. I mean, like that moment where he was speaking with Louis and like was kind of admitting to him and kind of starting to make amends. I suspect that that's going to be a theme throughout the whole episode. There was this moment, or throughout the whole season, there was this moment when he first kind of walked back with the handover rounds, where he kind of like looked at Santos in a very specific way, like not with anger, but in this way that was a bit different. And I wonder if they're going to build up to like him having a conversation with her about kind of how things went last season. So I'm really interested to see how that arc plays out for sure.
Totally. Yeah, absolutely. Let's get into a couple of fun things that you and I also really texted about. Was the new intern who said the Q word, Shaz.
Oh
and
my God.
Also like, I imagine at that moment that you were screaming at the screen.
I was screaming at the screen. I turned to my husband. I turned to the screen. I'm like, he said the Q word. Why? Why would you do that? And like, that is like,
what is the Q word, Shaz?
The Q word. I feel like scared even saying it. I'm not at work, so I can say it. The Q word is quiet. He said it. And I'm like, why did nobody take note of this? And I know that there were healthcare workers, Emerge people everywhere also yelling at the screen, because we do not say that word in the Emerge. I think they had a reference to it in the first season. I feel like they talked about the keyword, but like, no, we don't say that word. And he did. So I feel like it's setting the stage for what this season is going to be like.
I also yelped in a moment because, as our listeners may know, I'm from Alberta originally. Shaz, you live and work in Alberta. And there was a shout out to Alberta in this episode, which I was like, wait a second, did they just say Head Smash and Buffalo Jump? Because that was a place that I visited when I was a kid. It was like a beautiful spot. And that's where Robbie's going on sabbatical. So that was like really exciting.
That was like another moment where I was yelling at the TV, but like in such a good way. I'm like, oh my God, they could pick any place in the world, any place in Canada, and they picked Alberta. So that like totally made me smile. It really, it warmed my heart. And I think it really fits with the narrative as well. It's like, a beautiful place. It's kind of more remote. And so it plays into him stepping away. It has a spiritual
aspect to it too.
Exactly. Yeah, exactly. So it kind of speaks to him stepping away, having distance, and really plays into what his character arc is going to look like this season. Okay, so that's it for our season 2, episode 1 recap. This was definitely a slower episode, but clearly an intentional one where we started seeing new characters, kind of got caught up with all these characters that were there from before. And it felt like a deep breath before what we know is coming next because someone said the keyword. So definitely going to be a big season again.
And we really wanted to put this recap out to many of you. You've been so supportive to us in doing our season 1 recaps. Our approach is a little bit different. We really want to focus on helping you understand what's happening on screen, what's real. We talk about the medicine, we talk about the heart of medicine and what it feels like to do this work. And we just really appreciate sharing this with you as co-fans to us, because we are huge fans of this show.
And if you want us to keep recapping season 2, tell us. And if not, that's okay too. But we want to hear from you so we know what's going to land the best going forward.
Yeah, and this episode is really worth sitting with, and it's a great start to season 2. We're excited to see what's next.
Yes, because even like things did feel quiet. Again, I'm like so nervous to say that word, but they did feel quiet in this episode. But we know even from the promos and you know what we expect with the Pitt that this is basically probably the only quiet episode there's going to be.
Thanks for tuning in today, everybody. A reminder that the Doc Talk podcast is for general informational purposes only and is not intended to replace medical advice from your own healthcare provider. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your personal health needs.